Okay, so I'm going to present you my my thesis article, which is a systematic review about the public health co-benefits of strategies consistent with net zero emissions. So, oh, okay. So first of all, the Paris Agreement, which was signed in Paris in 2016, set goals of reducing greenhouse gas emissions by mid-century. So almost all countries agreed to those objectives. And from then, many non-governmental organizations or institutions developed net zero emission scenarios that describe pathways to reach and to limit global warming to 1.5 to 2 degrees. And in parallel, we have the IPCC, the latest IPCC report, which puts forward the co-benefit actions that could make a strong case for driving impactful mitigation actions. So what are those health co-benefits? They're mainly about reducing air pollution, shifting from globally from cars to active travel, which would increase physical activity, and also switching diets towards more plant-based food. Those health co-benefits, those health pathways, are each responsible of high millions of deaths each year. So more than 5 million deaths are globally attributable to air pollution from the combustion of fossil fuel. We also have about 4 million deaths linked to the lack of physical activity in the population. And the most important, more than 10 million deaths could be prevented by adopting healthier diets. So our main objectives were to review the evidences regarding these health co-benefits associated with prospective net zero emission scenarios, and to compare those health co-benefits across different health impact assessment studies, which accounted for various sectors of activity of emission and those three co-benefits pathways. So we had two main inclusion criteria. The first one, the studies had to describe a prospective net zero emission scenario. So that scenario had to reach net zero, so net zero greenhouse gas emissions over time, or to limit global warming from 1.5 to 2 degrees by the end of the century. And the second criteria was to provide the quantitative health estimates, quantitative health impacts associated with those prospective scenarios. So the health impacts could be expressed as average death or life years gain, or for example, life expectancy or else. So we screened more than 2,000 studies and ended up with 58 in our inclusion. So we can see here that most of the studies were conducted in high-income countries such as United States, Western Europe, or China. We also had several studies in India. And we also had 12 worldwide studies that included all global greenhouse gas emissions. And we had a bit more than 10 studies, 10 regional subnational studies that were again mainly conducted in Europe, Southeast Asia, or North America. And this is the geographical distribution of the first authors institution. So we can see that almost all studies were conducted in those three areas. We did not have a beginning restricted date, so we see that the first studies was published in 2012, and then there is a growing evidence, growing health impact assessment studies on those on this subject following Paris Agreement. So from 2018, we can see an increase in the studies published. In red, it's we can see the studies that we could include in our health impact comparison. Some studies were still included, but we could not scale the health outcomes, so they are in blue. We also categorize the scenarios based on the mitigation levers that is mainly used. So such as energy decarbonization, financial instruments, conducting health in all policies, or demand side policies, here written as sufficiency scenarios. And we also had many scenarios which did not exactly detail which decarbonization levers they would use. We can see most of the studies were multi-sectorial or encompassed all emission sectors, but we also had sector-specific studies, for example, in the energy sector. We also had sector-specific for agriculture, forestry, other land use, so that's agriculture and food system, and as well as with housing or transport sector. And finally, most of the studies assessed the health impact associated with reduced air pollution, while there were a few studies focusing on physical activity due to active travel and diet benefits largely from plant-based food. Oh yeah. Oh yes, we have a question. I can take it now if you want.
Yeah, sorry to interrupt you. I don't know, maybe I missed, but what are the inclusion criteria for your systematic review?
Yeah, we had two main inclusion criteria. So first one, the study had to provide a net zero emission scenario. So a scenario that reached the Paris Agreement objectives. So temperature targets or greenhouse gas emissions, carbon neutrality. And the studies had to provide quantitative estimates of health impacts associated with those net zero scenarios.
And what kind of study design? So these are modeling works.
Yeah, they are all health impact assessment studies. So they are going to implement an air pollution model or a change in physical activity behavior or diet behavior. And then based on that and on dose response function, they are going to perform a health impact assessment. So assessing quantitatively how much death can be prevented by a change in exposure.
Okay, thank you very much.
Yes, so those were mainly the main emission sectors and co-benefits pathway. But there are others. It's physical activity, diet, and air pollution are the main one, but there are also others. We can talk about it later. So here's how we regrouped the scenarios based on the levers that they would use to reach net zero. We can see that there are several who did not, who only mostly were based only on temperature targets and had only theoretical, there were only theoretical scenarios, so not precisely saying how society would reach net zero or temperature targets over time. We can see here the linkage between the different type of scenarios, the emission sectors, and the pathways, the health co-benefit pathways, and the health outcomes between for each scenarios. So we can see first that air pollution is overrepresented, as I said, and many studies emphasize the fact that the health benefits are concentrated with population density and could depend on the numbers and the sectors of emissions considered, as well as the baseline scenarios. In health impact assessment, we always have a comparative scenario. So this baseline scenario also is an important driver of the magnitude of the health benefits. For air pollution, which was the most studied pathway, a study put forward the fact that sufficiency policies would bring more health co-benefits than energy decarbonation scenarios, and would add and added to that sufficiency policies could address energy poverty, whereas it would be more complicated with only energy decarbonation policies. Studies scenarios based on renewable energy would also bring higher health co-benefits than the scenarios only relying on technological improvement with carbon capture storage technologies or others technology. And we also had a study only assessing air pollution, which stated that having active travel policies would reduce more air pollution than only electrifying the vehicle fleet. So the ranking of the different pathways, health pathways, depended also on regional context and on the number of mitigation actions that could be included by the health impact assessments. But for all countries, we had a study who compared with the same method those health impact across pathways, and stated that it is clear that diet pathway has more health benefits, has more health benefit potential than air pollution or physical activity pathways, and that's true for all regions of the globe. We also performed confidence assessments based on previously published criteria. We can see that almost all the modeling criteria are well respected. What's missing more is the equity impact, so including equity impact of policy adoption. Also discussion on the adverse consequences of mitigation actions, and shared that data and code. We had still some information, interesting information, such as the fact that clean energy access in India would avoid millions of stunted children, and particularly in the most disadvantaged area. Also, the electrification of the transport sectors in the United States was shown to benefit lower socioeconomical communities more effectively than housing electrification. So we still had some results, but not many scenarios, not many articles would take them into account. Also in the housing sector, emission scenarios relying on domestic biomass burning, so wood burning to heat their house, that could contribute to higher PM 2.5 emissions and subsequent health impacts. The lack of data and code is a barrier in this field for advancing health impact monitoring and timely feedbacks to decision makers. So the main results emerging from those scenarios is that out of almost 100 scenarios, 94 of them yielded health co-benefits that could go up to 15-18% of all-cause mortality. So half of those scenarios reduced all-cause mortality by more than 1.5%. That represents 10,000 deaths each year in France and almost 1 million deaths per year at the world scale. So those public health impacts could be really great and significant. And there's also economic impacts associated that are associated with those health benefits. On the 13 studies that assessed the cost of mitigation actions, 11 of them found that the health impacts, the economic impacts, economic benefits associated with the health benefits would offset the policy, the costs of mitigation policies. So that's a strong economic impact. So, and it means that those mitigation policies wouldn't cost anything to society. There is also indirect economic impacts, such as the creation of millions of jobs, fewer workload days, and better billions of dollars for labor productivity. Also, crop yielding increased and reduced hospital expenditure, as well as a more resilient energy system. Some research gaps. We had a high heterogeneity of across all the scenarios, emission sectors, and health co-benefits, as well as with the modeling approaches. So that prevented us from drawing and conducting meta-analysis on those health impacts. We also had some uncertainties in the health impact quantification with the lack of specific exposure response function to specific population. Also, the distribution of exposures could vary highly between the scenarios. There is also synergistic and antagonistic effects that are hard to account for, such as a synergistic effect would be, for example, the reduction of air pollution or noise pollution with active travels, or antagonism effect could be the fact that it's going to be more complicated to cycle in a warming and in a warming world, or when there is high precipitations. Also, all the scenarios assume the same healthcare efficiency across all their scenarios, but it is known that during periods of extreme heat, healthcare can be overwhelmed and is less efficient. So in our mitigation scenarios, this healthcare efficiency could go on, while in a warming climate, it's going to be more complicated. There is also a lack of quantitative vulnerability indicators and a lack of use in the few indicators that we have. And even so, studies could address a bit more inequality impacts qualitatively, since those inequalities represent also public health issues. Also, health impacts can be underestimated in all sectors. So with the transport sector, as I told you, switching from cars to public transport or walking, cycling would also bring other co-benefits with reduced noise, reduced road traffic injury, and reduced air pollutions. In the housing sector, having clean energy sources would reduce lower respiratory infections due to black carbon. So those indoor air quality pathways are rarely taken into account. In the food system sector, we could also have benefit from Campylobacter infections and also antimicrobial resistance due to the high use of antibiotics in animal husbandry. And also with the deforestation, we also have spillovers of certain specific infectious disease. And lastly, perinatal and mental health issues are rarely or never taken into account in those health impact assessment. It's more difficult to scale and to model them. Also, there is another famous co-benefits pathway that's not taken into account for now in those scenarios, which is urban green space. We know that those actions and those scenarios can be included in our societies. For example, for air pollution reduction, it is known that collaborative actions across policymakers, civil society, communities, and scientists can be beneficial. Also, we know that active mobility policies would be more effective if we integrate safe walking and cycling infrastructure, as well as educational programs. This is the same with dietary modification that would be most effective with education, persuasion, and environmental restructuring. So lastly, we can conclude that climate benefits are not sufficient lever for society to engage in mitigation actions, else we would have seen already. It would be the case already. Climate benefits are only perceptible in the long term. So we can expect, even if we put all mitigation policies forward now, we would see the climate benefits only in 20 to 50 years. Whereas the health benefits, especially from air pollution and from active travel, are going to be perceptible in the short term, as well as in the long term, but they would also be perceptible right now. The climate benefits are conditioned to the mitigation actions and the mitigation policies of other countries. For example, United States just got out of the Paris Agreement, so the climate benefit that they could bring to to global Earth are not on the table anymore, but the health benefits are not conditional to what others or even what neighboring countries adopt. For example, all national studies found health co-benefits associated with their single mitigation actions. And lastly, climate benefits are going to be diluted in the global on the global Earth, while health benefits are going to be specific to the population that that gets into action and to mitigation policies. So to conclude, I would say that climate mitigation actions can constitute real efficient public health policies with direct and indirect benefits for healthcare costs. And from a health perspective, not all decarbonization policies are equal. Well, thank you for your attention. And if you have any questions.
Merci beaucoup, Léo. Romulus, tu as déjà levé la main, s'il te plaît.
Yes, thanks for the talk. I thought it was really interesting and comprehensive. I have a general comment. The fact is that when we evaluate programs of this kind, we often evaluate them through number of lives saved or number of years gained by the population and so on and so forth. And this is okay when you talk about health alone, but if you want to talk about economies, then the situation is more complex because just saving lives sometimes translates into an aging population and struggling economics. Like in Japan or Italy, you would say this would rate quite high on your scale, but in fact they have aging populations, and this poses significant difficulties in terms of what kind of policy they can still adopt and how will they participate in the global effort and so on and so forth. So I think that it would be very good to have a discussion of natality in participating countries, to have something like a number of babies per woman, and this discussed together with the economic burden of various programs. I think it really is a missing key point in all this discussion.
Yeah. I agree with the first thing, that is that we do not take into account for economic evaluation. We do not take we and they. Nobody takes into account the fact that we're going to save old lives. So that would not be economically rentable, but for those economic evaluation, we rely on, there's two ways to do it. So there's the direct medical healthcare costs, which are rarely taken into account, but it could actually represent also millions of euros each year. And of course, there's the limit of using here, as they use majorically, the indirect health impacts, which are intangible economic benefits, so they're not really perceptible by economic actors. But as our countries and our governments put values on our lives, it can still be taken into account. But yeah, I still agree with the first thing. On the controlling natality, I think that's a more open debate. But
not about controlling, just reporting. Reporting,
yeah. But the thing is that it's not so much, well, in those questions, it's not so much the number, but how much we consume and how much we use per life. So, for example, if there is 1,000, if there's a billion American people lifestyle on Earth, of course it's gonna be hard. But if everybody only emits, well, I think it's like 2 tons of CO2 per year, we could actually reach carbon neutrality, and that's without changing so much of our life. But yeah, I think that's another debate about natality, because in our projection, we actually rely on official demographic projections. There are assumptions in those estimation, but usually when we can do sensitivity analysis to see, for example, if fertility increases, how is the population going to change, and how the health impacts of mitigation actions can be distributed. But usually it doesn't. It's not so much that point that is that it's not the greatest uncertainty in health impact assessments. And for example, there were a study in China that had an interesting result about that. So China is one of the greatest aging country, and they put forward the fact that the mitigation actions and the health co-benefits associated with these scenarios would offset the burden of population aging. So yeah, there are some discussions about that, but I agree with you. It's not the case for all studies.
Thank you very much. Just to frame it, juste pour recadrer ça dans une perspective santé publique. Évidemment, c'est pas juste saving old lives qui est la question, mais les années de vie passées en bonne santé, parce qu'évidemment, les personnes âgées en bonne santé contribuent très fortement à la société et permettent des économies à la société, la garde des enfants, le soin des malades, etc. Il ne faut pas oublier ça. Et puis, si vous voulez en commencer ces discussions-là, il faut aussi discuter, bien sûr, des questions d'égalité, parce qu'on ne peut pas parler de la natalité sans parler de l'égalité des droits. Voilà, merci beaucoup. Juan Carlos, tu avais une question?
Merci. Bonjour à tous et tous. Hi, Leo. Congratulations on the study. I have a question. So we see that air pollution was overrepresented by a factor of 10 at least, but diet pathways have more benefit potential, true for all regions, as you said. And I was thinking perhaps due to the well-developed air pollution monitoring systems or research designs that we have, perhaps it's less methodologically complex or less expensive to study air pollution than diet or physical activity. So I had about 3 ideas, and then I would love to know what are your thoughts on why we see that disparity, right? So the first one is that maybe we're seeing a case of path of least resistance, where it is easier to study air pollution because data is available, we have the research designs, et cetera, or because it's, again, like less expensive and so on and so forth. It might be that air pollution research is just in absolute numbers a bigger field. Or it might be even heuristics. We have to account for the fact that maybe researchers tend to believe that air pollution is where most of the benefit would come from. So I just want to hear your thoughts on why we see this disparity between air pollution and the other co-benefits.
Yes, indeed. I think the fact that air pollution has been historically more studied, so now there is more researchers on this, so there is more interest in it. I think another thing that could promote that is that reducing air pollution doesn't rely on population behaviors. Whereas active travels, diet system has to rely at least a bit on population behaviors, and that might be more complicated to project in a prospective scenario. So that might be a second thing. But yeah, I think maybe there's another thing is that actually assessing the impact of diet is more complicated. It's more, you have to take into account many different risk factors, whereas for air pollution, we have exposure response function that are more specific and more simple to address. Yeah, I think it's the main.
Léo, juste une question de se poursuivre avec ces commentaires-là. J'avais remarqué que beaucoup d'études dans ta revue systématique venaient de la Chine. Est-ce que éventuellement une réponse possible à Juan Carlos serait aussi que mais les problèmes de pollution en air, en tout cas là, pour ces études-là, il y a 10 ans, il y avait un contexte de pollution en air qui était à un tel point qu'il y avait des impacts majeurs parce que les gens n'avaient pas seulement les impacts au long terme, mais aussi une morbidité, mortalité même assez aiguë. Alors, en tout cas, ce qu'on entendait, ça explique aussi peut-être pourquoi il y avait autant de travaux là-dessus, parce que c'était vraiment un problème très, très tangible. Est-ce que tu as, est-ce que tu as des réflexions autour de ça?
Oui, je pense oui, je pense qu'il y a le fait que effectivement ce soit des pays plus riches, donc la recherche est peut-être un peu plus développée, mais effectivement le fait qu'il y ait par exemple beaucoup d'études en Inde, notamment l'Inde qui ne fait pas partie des pays à haut revenu d'après la Banque mondiale, ça montre effectivement que les problèmes de santé publique associés permettent de mobiliser la recherche, donc c'est plutôt une bonne chose. De mon point de vue. Voilà, il y a le même exemple un peu. Après, je pense qu'il y a aussi des enjeux industriels. Je sais pas comment dire, mais ouais, peut-être industriels. Par exemple, le fait que la Pologne ait beaucoup d'études, notamment sur le nucléaire, sur l'énergie, et donc en prenant en compte notamment des scénarios nucléaires. Le fait que, par exemple, en Inde, il y a que là-bas qu'en fait ils aient regardé un peu les différences en fonction des niveaux socio-économiques. C'est parce que du coup en Inde, avec les systèmes de caste et tout ça, c'est aussi plus simple à étudier. Sûrement. Ce sont mes hypothèses, mais voilà, ouais. Je pense qu'il y a beaucoup ça.
If I may follow up, by any chance, do you have that sort of cross-tabulation where we see if air pollution studies, or the ones that at least focus on air pollution, are also mainly from, say, China and India, which have a very big issue on air pollution and health?
I don't have a figure about that, but
maybe if you checked it at some point-ish.
Yeah. Actually, yeah. So we can do in the other way around. We can consider that everything is air pollution, but there is physical activity and diet health pathways would be assessed in France, England, and from my memory. So yeah, there is it was France, England, and there is only one diet which take into account air pollution, the three pathways, so air pollution, physical activity, and diet. And this study is conducted in England, but focused on 9 countries from all over the world. So we still have one study that compared all those pathways all around. But yeah, or else it is mainly air pollution studies.
Very interesting, thank you.
Est-ce qu'il y a d'autres questions, commentaires, observations sur ce travail évidemment très complexe, qui est peut-être aussi juste le début de tout un...
j'ai pas précisé, mais l'étude va être publiée dans 2 semaines.
Dans quelle revue?
Dans Lancet Planetary Health.
D'accord, oui, je crois que c'était mentionné au début.
Oui.
Ouais. Et je crois qu'il y avait aussi un travail de modélisation d'ailleurs qui a été, je crois, fait dans le cadre d'un projet de master, c'est ça?
Il y a eu plusieurs projets de modélisation, Judith, autour de ce travail-là, dont un qu'a fait Léo lui-même pendant sa thèse, celui qui était que tu as vu dans le cadre du master spécialisé. Il y en a encore d'autres en cours. Voilà.
Ça c'est le travail de Kevin, donc en gros, c'est ça?
Oui,
Oui.
c'est ça.
C'est les travaux, c'est ça. En fait, tout ça, c'est dans le cadre d'un projet que pilote Kevin. Hein. Exactement. Voilà. Merci beaucoup à tous. Et bon après-midi, bon week-end à suivre.
Merci.
Bon après-midi.
Bon après-midi.
Et